Hello, I'm Dr. Christopher Brennan, founder of Long Island Aftercare. I created Long Island Aftercare because I saw firsthand how overwhelming and confusing the healthcare system can be for patients and families. Hello everyone, I'm Dr. Christopher Brennan, hospitalist physician and founder of laaftercare.com. Today I want to talk about something extremely important that many patients and families do not fully realize during a hospital stay. Discharge planning actually starts on admission. Many people think discharge planning only begins when the patient is ready to leave the hospital, but in reality, the planning process often starts the very first day the patient arrives in the emergency department or is admitted to the hospital. Why? Because hospitals must begin thinking early about what the patient will safely need after hospitalization. The goal is simple: provide the right care at the right time in the right setting, while helping patients transition as safely and smoothly as possible. When someone comes into the hospital, the medical team is not only treating the immediate illness or problem, they are also evaluating the patient's overall condition, support system, mobility, safety, insurance coverage, and what level of care may be needed after discharge. One extremely important part of this process is understanding the patient's baseline functional status before hospitalization. In other words, what could the patient normally do before they became sick? Could they walk independently? Did they use a cane, walker, or wheelchair? Could they climb stairs? Did they live alone? Were they independent with bathing, dressing, cooking, and medications? Were they already receiving home care services? Knowing how the patient functioned before hospitalization helps the medical team determine what has changed, what recovery goals are realistic, and what level of support may be needed after discharge. That information is incredibly important when deciding whether a patient may safely return home, require rehabilitation, need home services, or need additional assistance after leaving the hospital. That planning involves many people working together. Patients may interact with hospitalists, specialists, nurses, case managers, social workers, physical therapists, occupational therapists, speech therapists, pharmacists, nutritionists, and discharge coordinators. Each member of the team helps determine what the patient may need after leaving the hospital. For example, can the patient safely walk now? Can they transfer safely out of bed? Do they need oxygen? Will they require IV antibiotics? Do they need rehabilitation? Will they need home care services? Is the patient safe returning home alone? Do they need a skilled nursing facility or acute rehabilitation? Do they have family support? Will insurance approve certain services? These discussions often begin very early because arranging services, equipment, authorizations, rehabilitation placement, transportation, and follow-up appointments can take time. One of the biggest misunderstandings patients and families have is believing that discharge planning means the hospital is trying to push them out. That is usually not the case. In reality, early discharge planning is often about patient safety and avoiding delays in care. The earlier planning starts, the more time the team has to coordinate services, communicate with families, obtain insurance approvals, arrange rehabilitation, set up home services, and prevent unnecessary complications or prolonged hospital stays. Good discharge planning can help reduce hospital readmissions, medication errors, falls, confusion, and delays in recovery. Communication is extremely important. Patients and families should feel comfortable asking questions such as, what is the expected discharge plan? Will I likely need rehab or home services? What therapies are being recommended? What equipment may be needed at home? What does insurance cover? What goals need to be met before discharge? What follow-up appointments are needed? Another important thing to understand is that discharge dates can sometimes change. Patients may improve faster than expected, or sometimes new medical issues develop that require additional testing, treatment, or monitoring. Hospital care is dynamic, and discharge planning often evolves throughout the hospitalization. Families should also understand that hospitals must balance providing appropriate care while avoiding unnecessary hospitalization once a patient is medically stable. Remaining in the hospital longer than medically necessary can sometimes increase risks such as infections, deconditioning, falls, sleep disruption, blood clots, and other hospital-associated complications. That is why the healthcare team works hard to identify the safest and most appropriate discharge plan as early as possible. My advice to patients and families is this: stay informed. Ask questions early. Write things down. Know the names of your physicians, nurses, and case managers. Pay attention to the whiteboard in the patient's room, including the expected or tentative discharge date. And most importantly, communicate openly with the healthcare team. Better understanding leads to better communication. And better communication often leads to better patient care and safer transitions home. I'm Dr. Christopher Brennan. Visit liaftercare.com for more patient and family educational resources about hospitalization, discharge planning, rehabilitation, observation status, inpatient care, and navigating the healthcare system. Thank you for watching and welcome to the Long Island Aftercare platform. We encourage you to explore our new Patient and Family Education Center at liaftercare.com, a growing educational knowledge base designed to help patients, families, and caregivers better understand the healthcare journey. Our platform answers many of the most common questions people have during hospitalization, discharge planning, rehabilitation, recovery and post-hospital care, and more. We understand that during stressful medical situations, emergencies, or after receiving difficult news, it can be overwhelming to absorb and remember everything healthcare professionals are explaining. That is why Long Island Aftercare was created, to provide clear, easy to understand educational resources that patients and families can access anytime at their own pace. Be sure to explore our powerful Map Resources section, which allows you to search and filter healthcare facilities and services throughout Long Island and surrounding areas based on the criteria most important to you. You can filter by affiliated healthcare system, clinical capabilities, inpatient versus outpatient services, specialty care, rehabilitation options, skilled nursing facilities, home care services, county location, and much more, helping patients and families make more informed healthcare decisions. Our goal is to improve communication, education, transparency, and healthcare navigation for patients, caregivers, and families during some of the most challenging moments in life. Please follow Long Island Aftercare on our social media platforms for ongoing educational videos, healthcare updates, patient resources, and new content. YouTube, Facebook, Instagram, X. Thank you again for watching, and thank you for being part of the Long Island Aftercare community.